What are common respirator hazards in construction? Have you ever thought about what construction workers breathe in while on the job? The truth is, construction sites are filled with respiratory hazards that can harm lung health. Let's take a closer look at what these hazards are and how they impact workers in this high-risk profession. First up is dust and particulates. Dust is the most common respiratory hazard on construction sites. It comes from materials like wood, concrete, and various aggregates. One specific type of dust to be aware of is respirable crystalline silica dust. This dust is created when workers cut or drill into concrete or stone. Inhaling silica dust can lead to serious lung diseases like silicosis and chronic obstructive pulmonary disease. Next, we have fumes. These arise from activities such as welding and asphalt work. Fumes are tiny particles that can easily enter the lungs, causing irritation and long-term respiratory issues. Bitumen fumes from asphalt and welding fumes are particularly harmful with prolonged exposure. Asbestos fibers are another concern, especially in older buildings. While the use of asbestos has decreased, it can still be found in materials used during renovations or demolitions. When these materials are disturbed, microscopic fibers are released into the air. Inhaling these fibers can lead to lung cancer and other serious illnesses. Gases and vapors are also present on construction sites. Workers may encounter harmful gases from solvents, adhesives, and paints. Some vapors, like isocyanates from spray coatings, can cause respiratory irritation and sensitization. Lead dust is another hazard that workers must be cautious of. When surfaces coated with lead-based paint are ground, welded, or cut, lead dust is released. Lead exposure can have serious health effects and poses respiratory risks. Given the variety of these hazards, choosing the right respirator is essential. Filtering facepiece respirators, like N95 masks, are effective against dust but not against gases or vapors. For those hazards, chemical cartridge respirators or supplied air respirators are necessary. Employers in construction must implement a mix of engineering controls, such as proper ventilation, and work practices, like wet cutting to minimize dust. When these measures are not enough, appropriate respirators must be provided and fitted correctly. In high-risk professions like construction, workers have legal rights to a safe working environment. This includes access to proper respiratory protection. Understanding these hazards and knowing the rights of workers can help prevent serious lung diseases. So, to recap, common respirator hazards in construction include dust, fumes, asbestos fibers, gases, vapors, and lead dust. Awareness and proper respiratory protection are vital to safeguarding health in this demanding field.